Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Margal Medical. This week we're going to be talking to you about multidisciplinary approach to patients with shoulder pain. If you have pain in your shoulder, you definitely want to stay tuned. A lot of great information coming up, so stay tuned. Okay, Dr. Mike, well, shoulder pain. I know this one pretty good. This is what got me all excited to get into the field of chiropractic, because at the time I was having pain in my shoulder, but it happened to be a problem in my neck, and my dad's chiropractor adjusted my neck, and lo and behold, my shoulder pain went away. But then years later, as a result of a football injury, I developed a lot of early onset arthritic change in my shoulder, and we went through the course. And as the viewers have seen before, I was the first patient in the office to get a regenerative medicine injection in the shoulder, and it gets a little bit tricky. The shoulder is kind of an unstable joint. So if you have shoulder pain, what are kind of the first steps in figuring out if it's the shoulder or if it's coming from another part in your body?
It's a very good question, and it's a very common problem. As you mentioned, you're playing sports. I played baseball, I had some shoulder problems, but just people at work doing a lot of repetitive things. We're human, we use our arms a lot. And the concept is that when people think of shoulder, it always has to be on their shoulder. But there could be referred pain down into the arm. So rotator cuff, for instance, is commonly referred in the arm, or shoulder blade. So if the pain is in the back side of the shoulder, people think, oh, I must have just strained my back, or the people are getting thoracic back x-rays, when in reality it was their shoulder. So really it's just some basic questioning. When there's movement of the arm, does that elicit the pain? Is there elements that bring the pain to other locations? So really some good basic questions, and then examination is the way to start.
Yeah, and I really understand the importance of the exam, and that's why we have you and Molly on the medical side, because you guys are so detail oriented, and even Dr. Sherman and Dr. Brooks do a fantastic job on the chiropractic side of the practice in figuring out and playing detective, where is the pain actually coming from, because based on the exam, you guys have the ability to order the appropriate diagnostic test, whether it's an x-ray or an MRI. So let's say this is a straight up shoulder problem, and maybe we have a couple of things going on, some arthritic change, maybe a partial tear in the rotator cuff, that's a familiar term that we all hear, or maybe it's some damage into the cartilage inside that ball and socket joint. What are some of the options? We don't have to go right to surgery, right?
No, absolutely not. And the concept is people also go right to cortisone injections, and that's another option. But usually we will try to get some inflammation down. If the pain is there, really difficult to move that arm, a course of ibuprofen type products or anti-inflammatory icing or our laser treatment, really to reduce that inflammation is still important. We got to get the movement back to also help the examination. Is that more likely the person's joint pain? Is it because of the arthritis restriction, or is it with motion of the muscles that attach there, such as there's 4 muscles that make up the rotator cuff. So if we look at those things, we start simplistically, again, anti-inflammatory movement with our, again, chiropractic services, getting the distribution between the neck, the shoulder blade, the collarbone. All those movements are important to reestablish. And then maybe even some formal physical therapy to go going, because most commonly our examination gets the person the right starting point, and we don't necessarily need to run to a surgeon, but we also don't need to run to an MRI picture, as many people say, I need to get an MRI. We want to use good practices to start, and then really implement some good standard treatment to get mobilization going.
Right, and oftentimes what we see, if we do need to get the MRI, if there's a partially torn rotator cuff where it's not completely torn, again, like you had said, we want to avoid cortisone, because the research has shown every time you inject cortisone, it's going to cause more damage. So that's the last thing you want to do, is cause more damage to damaged tissue. That's where we kind of recommend some of the regenerative therapies, those Wharton's jelly allograft injections, but also too, the PRP injections that work really well to help the body heal itself over time. Now, if there's not any damage, to the tissue itself, and we kind of rule all of that. Sometimes, and this just happened to us, you know, our daughter Kylie's 14, she's playing a lot of tennis, kind of ramping up. She came home the other day with a lot of shoulder pain. So Colleen and I, and as our physical therapist, Colleen does a really good job, we were able to kind of ascertain that it wasn't really her shoulder, it was more the shoulder girdle and more the soft tissue. So as a young athlete playing a lot of sports, and we see this more and more now, you know, the body just hasn't developed the way it, you know, does in the case of like the increase in level in sports participation. So those muscles get tired and they develop those what are called myofascial trigger points. That can definitely be resolved with a couple of different options. We've been using laser therapy that works really good to help relax the muscle. But if we needed to go the extra step, those trigger point injections do a great job in helping to relax the muscle. The big difference is in our clinic, we use a natural product called Serapin versus more of a steroid, which some clinics use as well.
Yeah, and as you bring up the adolescent or the child in growth, again, as you mentioned, there's differences, and again, because the person's also getting taller, bigger, or what have you. So we also think that in a sense of an adult who's finished growing, but we call repetitive strain injury. So if you're doing a job or doing something with repetitive movements, such as playing tennis as a repetitive motion, you develop those same trigger points, you develop those same muscle tension areas because of overuse. So we can use the same treatment options, use the laser, use the trigger point injections, get that muscle group down a notch so we can really get that to the root of the cause of the problem, underlying degeneration, arthritis, or again, a rotator cuff strain or injury. So those things are really going to look at all the spectrum of age, but really comes down because we're using the body parts. And if there's asymmetries, imbalances, poor posture, poor mechanics, that's what we're looking at also, because those things are many times neglected because you said, oh, look at the picture, it looks like a rotator cuff strain, but they're not looking at the other big picture. We want to put it all together.
Right, and that's the big difference. We're always looking at the root cause of the patient's problem. Well, that's it for today. If you'd like to learn more about our practice, please check us out on the web at marvelmedical.com. And also, please consider subscribing to our YouTube channel. We've got a lot of great patient educational videos there, and we really appreciate all the feedback. I hope everybody has a great day. We'll talk to you soon.
Bye now.